Hi everyone, Dr. Remy from Pain Free and Fit. Today, for those of you with degenerative discs, herniated discs, and bulging discs in your lower back, we have the essential early morning hip warm-up exercises. Hope you enjoy. So if you've seen any of our other videos on the channel here about disc herniation, bulges, and degeneration, you know that we've discussed the morning being a very dangerous time for discs because overnight when we're recumbent, the discs imbibe water, they rehydrate, and thus they become pressurized and more likely to aggravate symptoms because of protrusions and bulges and herniations. So one of the first things we like to do in the morning is to wake up our hips and our gluteal muscles, because many times when we've been sleeping, especially on our side in the recumbent position, the hip flexors will tighten because the legs are tucked up and the gluteal muscles will weaken. So first thing in the morning when you're coming out of bed and starting your day and moving, if you're not having correct hip mobility and activating the hip muscles correctly, you're going to be much more likely to bend and move from your lower back, which again is rehydrated and repressurized, thus setting up the chances for you irritating the lower back. So we like to take 3 essential movements for the hip muscles to decrease the risk of irritating our discs first thing in the morning and throughout the day. Here they are. We begin with a kick and curl exercise, which is basically keeping a posterior backward shift of the ball into the socket. Many people with disc problems have an anterior hip malposition because of poor posture tendencies and overactive hip muscles, where the hip actually slides forward in the hip socket. If you're not sure if that's for you or not, check out our body analysis at painfreeandfit.com. We have a whole analysis of how to figure out what are your mechanical issues that are aggravating your disc problems. But keeping a slight backward slide of that side of your hip in the socket will start to activate the glute max to pull that hip back, and you're going to flex your hip. Now, if you have poor balance, you can hold on to something. If not, it's good to actually do this while balancing on that foot. The opposite leg that's not being picked up is kept tall at the waist, so you avoid hip hiking, which is an upward shift of the pelvis and a falling of the ribs. You want to be tall on that standing side. As we do that, we're going to do the kick, which is a forward motion with the knee. That helps to stretch the hamstrings, which many times are also tight in disc herniations. We can also bend the toes up with that, which helps to stretch the calf, the plantar fascia. First thing in the morning, it also helps to stretch the sciatic nerve. And after a second, we curl and go backwards. So this is a back and forth motion, taking a few seconds and pausing at the end ranges. I'm focusing on that backward slide of my hip bone in the socket, and I'll do 8 to 10 repetitions in that way. Turn around, do the same thing on the opposite leg. Then I'll use the second maneuver, which is our kidney bean mobilization. The shape of a kidney bean, we're going to take our knee, again, using that backward slide in the socket, maintaining a tall waist on the standing leg. And I'm going to move my knee out and around within a comfortable range of motion, trying to get as much height as feels comfortable, and come in a little bit, and then around my leg, coming back around my leg. I'm going to cross my midline of my body with my knee, and then come out. So I'm in the shape of a kidney bean. That's how it's called, the kidney bean mobilization. And that helps to stretch the posterior, the anterior aspect of the hip, even the inner and outer hip as I go in and out. And again, I'm looking for height and range of motion that's comfortable. Remember, this is a mobilization. I'm not trying to get maximum stretch. I'm just trying to go for a range of motion that feels comfortable, especially as my knee comes forward. I want to emphasize that backward slide in my hip socket if I indeed have that anterior hip malposition or anterior hip glide that many disc problems have. Once I go in a clockwise motion, I'll then reverse that into a counterclockwise motion on both legs. Again, varying the number of reps from 7, 8, 10 reps. You don't need more than a dozen reps usually in each direction, both sides. And we finish that off with a great activation of the glutes, which is we're going to bring our thigh back about 45 degrees. And as we do that, again, on the non-weight bearing side, the free side, we don't want to hike that hip up. We want to try to keep an equal distance between the pelvic bone, iliac crest, top of our pelvis, and the bottom of our ribs. And as I bring that leg back, I'm just going to hold that position and do a little kick curl exercise. Again, bringing my toes in and then bringing my toes out. So I'm curling the bottom of my arch, and then I'm flattening or stretching the bottom of my arch. My Toes are coming in and then out, and that's helping to activate our glute medius on this side, stretching tight hip adductors, which many times leads to problems such as anterior pelvic tilting. And again, I'll do 8 to 10 reps on that side. After I do that, my hips are going to be not only loosened in our range of motion, but my glute muscles, my glute max, my glute medius, will be activated so that when I begin to move in the morning, my spine can remain in a neutral spine. If you know your RPI, reverse posture isometric, or how to place your spine, neutral spine, again, you have to learn that through an analysis because that's different for all of us. Once you have that, the hips can move. You can bend and do things in the morning. You have hip range of motion and flexibility. The glute muscles are working actively, so the back muscles don't have to compensate and overwork for weak or, let's say, still slightly asleep glute muscles, inhibited glute muscles. Takes a lot more of a normal motion pattern first thing in the morning and helps you avoid moving abnormally from the lumbar or low back spine where you have hydrated discs and they're repressurized. They're maximum pressure during the day and much more likely to irritate if they bend too much. The whole idea of this warm-up exercise is to create fluid and strong hips that can move so your back doesn't have to bend. It can remain in a neutral spine position, decreasing your chances of injury. If you like this video on essential hip mobility drills for low back disc herniation, bulges, and degeneration, feel free to subscribe to our channel. We have a lot of great videos for disc problems on it. Give me a thumbs up below if you'd like to help me share this valuable information with others. Questions or comments, write in. As always, I'll do my best to answer. And remember, if you'd like to combine this hip mobility drill with more exercises, learning more analysis on your body, what creates mechanical pressure that aggravates your disc problems, check out our pain-free and fit fast track program for degenerative disc disease. It's perfect because not only disc degeneration, but even early stages of disc herniation and disc bulges eventually wind up as degenerative discs. So the exercises, the analysis, the self-rehab, how to strengthen your body to get back into fitness without irritating disc problems, it's all right there in that degenerative fast track program for you. I hope this exercise video on hip mobility drills for disc degeneration, herniations, and bulges early in the morning helps you with your chronic lower back disc issues.